Welcome to Senior Strategies, Tools for the Caregiver with Amy Decker and Shayne Silver. Join us on each show where you're going to enjoy a lively conversation that's going to connect you to the tools and resources that you'll need to coordinate care for the seniors in your life. We are so happy that you joined us. Hi, welcome to our show. This is our second show.
Yes.
So cheers that we've got a second one under our belt with some great guests.
Cheers. So excited for today.
So excited. My name is Amy Decker. I am the Director of Client Services for Senior Helpers. I am also a patient advocate and volunteer for VITAS Hospice. I am on the board of a wonderfully successful, fresh networking group called Senior Healthcare Coordinators. And so we just get a great opportunity to meet a lot of people.
I am Shayne Silver. I am a seniors real estate specialist with the Silver team at Keller Williams Realty. I'm also on the board for the Palm Beach County Partnership for Aging, which is an education and advocacy group for our seniors. We've been in this industry for a really long time, and we've met so many amazing individuals and businesses that are here to help our seniors community. So the purpose of the show is to be a resource for tools and strategies for you, the caregiver, to use on your journey.
And so one of the resources that I really benefited from, I joined a webinar through the Alzheimer's Foundation of America. And the topic of it was so interesting because it talked about how the decor in a home can affect somebody that has dementia. And I just thought the topic was really neat. I wanted to see what they had to say, and I learned so much about the lighting, where you position the furniture, the scents that are in the home. Very often people with dementia are afraid of what's behind a door. So a lot of times they're not going to go into the bathroom, or they don't want to leave their apartment if they're living in a community because they don't remember what's behind that door. Even cabinets in the bathroom. So they were giving ideas how you take a picture of what's in the cabinet, whether it's spices or medication, and put the picture on it. Take a picture of that you're going to be going into the living room.
That's a great idea. Great idea. I remember when we moved my parents, my mother has Alzheimer's, and when we moved her from independent living to assisted living, we and the facility took pictures of what her apartment looked like so that when we moved her, we could set up her next apartment the exact same way, because they are a creature of habit and routine. And for her to have to move to a new place would have totally disrupted her routine and could have caused her to slide. So
yeah,
I wish I had thought of putting pictures on the cabinets.
Yes, it was a great idea. And actually they've got webinars I believe every other week. I know they've got one big one a month, but it's Alzheimer's Foundation of America. You can get onto their website and then they'll send you the information, because I'm already going to be going to the next one next week, which is talking about how their moods change. But one of the guests that was on this webinar, her name is Wendy Mitchell, and she was diagnosed with early onset dementia at 57.
That's early.
57. I think it was, 2017. So she wrote 2 books. She's just finishing her 3rd book right now. And all it talks about is, in fact, the one is called What I Wish People Knew About Dementia and Somebody That I Used to Know. She's also got a blog that sounded really interesting too, that you can get on, that she, depending on her mood of the day, she'll do a blog. And it was called Which One Am I Today? But I actually got in touch with her on Facebook and asked if I could talk about her books and how great it was. And every page is just something new. She puts together what her feelings are for each day. Also the same thing with decorating the home and the cabinets and everything else. But she spent 20 years as a non-clinical healthcare worker before being diagnosed with young onset dementia in July of 2014 at the age of 58. And she was so shocked by that no one really knew what to talk about. No one really knew what to say to her.
Well, most of the books we have are coming from the clinicians. And what's amazing about her and her story is she's writing the books from her point of view. She is the one suffering with this disease. So it's interesting to see, for me specifically, a caregiver caring for someone with Alzheimer's and dementia, you know,
Getting
hearing
right from
her
the person that,
exactly hearing her point of view in what she's dealing with, because that helps me understand what my mom's dealing with.
Yeah, so she'd be a great person to get in touch with. Like I said, she's coming out with her third book. But because this show is so much about resources and sharing things, each week I think we'd like to have a little snippet of someone or something that we can share with you, that you can go to her Facebook page, Wendy Mitchell. And I think the name of her original one was Somebody I Used to Know. So it's worth looking at.
That's a phenomenal resource. Well, you'll have to fill us in next time on the next webinar.
Yeah, I will.
I wanted to talk a little bit about caregiver burnout. And we're going to have a whole show, that's a whole nother episode, caregiver burnout. But we hear so much in today's society about self-care. And it's really hard for a caregiver to care for someone when they haven't cared for themselves, right? We can't pour from an empty cup. We hear that all the time. And a lot of times caregivers have this guilt if they want to or need to step away to care for themselves. Well, I did that this weekend. I needed some self-care.
Good for you.
And I took
I
detached, and I took a 4-day weekend with some amazing, amazing women, my best friends from my childhood, who I haven't seen in the last few years due to COVID. And I took a girls' trip and totally disconnected. And we had so many laughs and
not that your phone probably wasn't blowing up anyway.
My phone was blowing up.
I'm sure.
I still
Some of them
got
are me, sorry.
100 calls a day from my mom and 100 calls a day from my dad and my family, and work. But sometimes we need to do that. And as I was talking through some issues I was having with lifelong friends who know me so well, I realized that a big part of my self-care as a caregiver is the support group I attend.
Yeah.
I go to a support group for caregivers of specifically of people with Alzheimer's, and I've been going for years. And as I'm talking to other people, I realize the things that are coming out of my mouth or the things that I have heard for years from that support group. And it is a form of self-care for the caregivers. For me, it is a little bit of a respite. And for some people who are living with their loved ones who they're caring for 24/7, it is a little bit of a respite. And
but you also get to meet others. I think when you're the caregiver, so often you hold it in, you hide it in, so you think you're the only one dealing with it, and you don't want to burden anybody else by talking about it to anyone. But when you go to the support group, you realize everybody in that room is dealing with it.
It really makes you feel like you're not alone.
Yeah.
And it really gives you resources. People have been through the same thing.
Right.
And what's worked for them and what hasn't. And because of that, and because of how wonderful we both know that is, we do have, and aside from this show, a support group for people caring for anyone going through the aging process. They don't have to be someone suffering with Alzheimer's.
Because I know somebody showed up last time and they said, is this strictly talking about dementia? Because my dad doesn't have dementia. So it's facets of all of it.
And it's for anyone caring. It's for those who are like me, who are the sandwich generation, who have children and who are caring for children and their parents. You could be caring for a spouse, a sibling, a parent. It's really for anyone. And we really want to give you those tools and show you that you're not alone. And each month we have a different facilitator. So this month, actually, it's on Thursday, May 18th at 5 p.m. at Allegro Senior Living in Boynton Beach.
It's on Hagen Ranch Road.
On Hagen Ranch Road. And we have Dana Ratsprecher, who is a licensed psychologist. She works in a number of assisted and independent living communities. And she works with the residents, and I'm hoping that she could give us, kind of like the woman that wrote this book, give us an idea of what they're feeling and what they're going through, because the more we know what they're going through, the more us as a caregiver could understand how what we do affects them.
And our last event, support group, it was standing room only. It was wonderful. So many people showed, so many caregivers showed with their father or mother, or multiple times there was tears, there were crying,
there was also some laughing,
there was a lot of laughing. Yeah, but there was tears because it was so touching. So so
we do hope that if you're out there listening and you're local, that you will join us this Thursday
At Allegro.
at Allegro Senior Living in Boynton Beach at 5 p.m.
Uh-huh.
We will be back shortly with our guests for the show.
Shayne Garcia Deale and Shari Buffa. We'll talk about them next. So come back.
In support of all the work that Amy Decker and Shayne Silver do for our senior community, Prepared Care Emergency Companions is honored to sponsor this segment of Senior Strategies Tools for the Caregiver.
Hi, I'm Amy Decker with Senior Helpers.
And I'm Shayne Silver, a seniors real estate specialist with the Silver team at Keller Williams.
We are so excited about a new show that we're launching, Senior Strategies Tools for the Caregiver.
We know that being a caregiver can be lonely and very overwhelming, and we want to help.
And so we hope to empower you with resources and tools that you probably didn't even know existed.
We'll be having some great conversations with people and companies you probably never knew existed and never knew you needed.
We just can't wait for you to join us.
Come join us for some laughs and fun as we give you some tools to use.
See you soon.
Are you considering selling your home? Are you considering downsizing? Are you considering a transition to an independent or assisted living community? Are you considering moving to be closer to your family? Do you need a home more conducive to aging in place? If so, you want to talk to Shayne Silver, co-host of Senior Strategies and Senior Real Estate Specialist. Shayne and her real estate team are extremely knowledgeable and experienced when it comes to helping seniors and their families make life's important transitions. Shayne will guide you every step of the way, making the transition as stress-free as possible. To schedule a no-obligation consultation, call 561-735-3030.
Hi, welcome back to the show.
Welcome back.
We've got some great guests. They're our colleagues, they're our friends, they are companies that we refer to, they refer back to us, so we've known each other for a long time. We have Shayne Garcia Deale with Concierge and Mobile Medical, and we have Shari Buffa, and she's an insurance agent for Bankers Life and Casualty Company. So we're going to talk about what Shayne does, and then how Shari can help pay for Shayne's services with what Shayne offers.
And how they all work together and what a wonderful resource they are.
And they're a great resource. So we're going to start with Shayne first, and just kind of get with, she can do a little intro, who she is, what she does, and how she got where she is today.
Hello, thank you so much for having me, Shayne and Amy. My name is Shayne Garcia Deale. I am the VP of Clinical Sales for Concierge Home Care. We're a home health agency that covers most of the state. We take patients that have Medicare, Aetna, and a few of other insurances. I'm also a nurse, so personal kind of story. I got into this because I was a caregiver for my grandmother and my grandfather when I was about 12 years old, and sort of kind of took care of them up through high school, and always wanted to be a nurse so that I could find resources to help our seniors in the home. So that's kind of how I got into this.
And so let's start with Concierge. What is Concierge Home Care?
Concierge Home Health is a home health service that provides physical therapy, nursing, occupational therapy. We provide IVs in the home, anything the patient needs in the home, such as like a hospital in the home. So Medicare pays for those services 100%. Some of the other insurances, depending on copays, et cetera, will pay for some of those services in the home as well.
And so if we had somebody that was looking for your services, how would they get a hold of you?
So in order to initiate those services, I would need to obviously speak to somebody in the family, find out what physicians the family uses, who the patient saw last. We would have to have a prescription and a progress note from the physician that saw the patient last in order to start the care, a proper diagnoses to allow us to come into the home and provide those services. If the patient does not have a physician that they've seen recently or is not established with somebody, then we use mobile medical, or we can offer mobile medical. Do you want me to talk about that a little bit? Okay, so mobile medical is part of our company as well. We have nurse practitioners throughout the whole state that also do house calls. So we kind of work in tandem together. The nurse practitioner goes into the home, they can do the labs in the home, they can order x-rays, everything that the patient needs can be done in the comfort of their home. And then they also communicate back with the patient's physician. For instance, if the patient isn't able to get an appointment for 2 months, mobile medical goes into the house, sees the patient, follows up with their physician, sends a plan of care and everything so they know what was done in the home, and the patient can follow up, but we can initiate the home care services with the mobile medical prescription.
So will mobile medical then replace their doctors, their physicians, their primary care, or they just work in tandem with them when they're not able to get out?
Either or. So
Okay.
yes, correct. So there's a lot of patients that come from out of state. They have their physicians
Right.
in another state. They come here with a prescription. We can't use it in the state of Florida. It has to be a prescription from a physician or someone, a practitioner that has an MPI number in the state of Florida. So then we introduce mobile medical until they're able to get established with a physician. So no, we never take the place of their physician, but we can. Some patients, like I said, don't want to establish themselves with anyone here. They want to go back to their physician back where they came from. So we just kind of work with them when they're here.
So this could be either a long-term or a short-term.
Correct.
And what's nice, just working with senior helpers, Jane and I refer a lot back and forth. So if we go into a home and somebody needs wound care, or they need physical therapy or occupational therapy, or like you said, there's somebody from out of state that is just looking for somebody to take over while they're here. That's a great way, a great referral source. And Jane, the same for you. When you need senior helpers in the home.
Right. So we work very well in tandem together. And there's a little confusion between just home care in general. Senior Helpers does
Right. That's
private
a good
care.
one. Yeah, that's a real good one.
So
what is the difference?
They they do private care, which is the activities of daily living, cooking, cleaning, driving to doctor's appointments, med
Personal care,
management,
yeah.
all that personal stuff, and it's not covered by Medicare.
And it's ongoing.
Correct. Yes. So
Right.
that can go on forever.
Yeah.
Medicare does have certain guidelines, so we have to, initially see the patient for the first 30 days. If we have met our goals with that patient, we have to then discharge them and then send them to outpatient services, et cetera. If we have not met our goals, we can then recertify the patient, stay a little bit longer. But we work in tandem with the private duty companies because the services that Medicare doesn't cover, they cover. So it works really well.
And I think one of the things that that Jane and I really enjoy is being in this business together. We get to know the client, we get to know the family members, we get involved in the family dynamics, and very often, even now for some of the clients, for some of ours that have passed or maybe moved back up north, I still will get cards from them. I'll still get little moments of, we're thinking about you, you did so much for my dad. And we had a client that was in a community and he just at the sundowner time would get frustrated. He either wanted to call the police, you'll remember this, you'll either want to call the police or he needed to call his doctor. So they got tired of him calling 911. They got tired of him calling the doctor. It's after hours. So I, for about a month, was either Officer Decker or Dr. Amy. And they would call the phone and say, and it would be at any time. It could be at 11 o'clock at night. Hi, Dr. Amy? Yeah, he's at the desk. He just wants to make sure that you listen. And then I just would get him on the phone and let him talk to me. Or I was Officer Decker and I was, make sure I took the report. And I will investigate that. And he was fine. He just wanted to be heard for a few minutes. And so often, even with that, like I can go to Jane and say, well, maybe he needs somebody to come in and adjust his medications or do something to help him with the sundowners or
right. So our whole goal working together is to keep the patient for me, client for senior helpers out of the hospital, out of a nursing home. We do encourage them to go into ALFs as if it's time for them to transition, so we can help with that as well. We offer social workers as well to provide resources for the patients so they're not left alone. We refer to care management. We try to just put all those resources in the home so they can stay home living independently as long as possible and just be an extension of their care. So yeah, we work really well together. If Amy sees something, she calls us. If I see something, I call them. They can't always afford them or they may not have Medicare, but we still are a resource to answer those questions and connect them with the right company for them.
And so many stories. Like I think about some of the clients that we had. There was a woman, and it was her and her husband, and she was a classical music piano player, but her health wasn't good. Her nothing was going good for her, and so her and her husband ended up laying in bed a lot. And I think that was one of the biggest problems is they weren't moving, they weren't getting anywhere. So then you get Jane on board with Concierge to get in there and get some PT and get some OT and get them up and moving. And before you knew it, you'd go in and I'd say, teach me how to play the piano. And she'd sit down at the piano and start playing. And that gave her a little bit of, she had a purpose that day. And I think that's the biggest thing is they get depressed, they don't have a purpose anymore. And so once we can get Concierge on board with physical therapy, occupational therapy, get them feeling better, even if it's just to adjust their medications, then they have a purpose again because they want to get out. They want to do things.
And like you said, they just want to be heard.
They just want to be
They
heard.
just want to be heard.
Oh, yeah. Officer Decker and Dr. Amy, that went on for a long time. But it was fun. But, yeah, so it's always good just to have, people to refer back and forth to and how we can make a whole picture out of a family that hasn't been whole for a long time.
But it's nice to have those resources. It's nice to have kind of a one-stop shop where you know that when you're working with one company, that company has the resources and knows what to look out for and who to look for and who to call should it be needed.
Right. And you, I believe Mobile Medical, can they also offer like prescriptions, blood work, all that?
Everything.
So they do everything.
Vaccines, tetanus shot,
Okay.
whatever the patient needs in the comfort of their home. So it's
That's great.
It's concierge, but you know, it's all covered by their insurance. So.
Any other little parts of concierge other than Mobile Medical, other things that concierge covers that?
Besides, well, we just have a lot of different programs, like the Boats Memory Program, which is a specific
talk
program.
talk about that.
I'll tell you a little bit about that. It's a specific program, sorry, that we use in memory care places, so communities, I'm sorry. Sometimes physical therapy companies will not do physical therapy on patients with memory care because they're not going to show progression. To us, if the patient lessens their falls or there's some sort of improvement, we can report that to Medicare and we can stay a little bit longer. So we have different programs that help us. Just give the family hope, give the patient hope, get them up and moving around so they don't get contractures and, you know, kind of prevent those falls and all that stuff, and teach the caregivers and the aides and stuff in those communities and in the homes how to properly care. And we do that with senior helpers and other private duty companies when we're in the home, is teaching them how to properly care for the patient, you know, move the rug, move the table, you know, light up the path and all those things so we can work together to keep them out of the hospital.
Okay. And so how would someone initiate getting into contact with you?
So, yeah, just give me a call.
So just repeat your number.
Yes, my number is 561-699-2617. I will help you. If I can't help you at Concierge, I will certainly help you find a resource. Like Amy said, we're part of senior care coordinators. We have tons of people that are part of that group that we can refer you to, and we will make sure that you get the proper care in your home.
And if you're a professional and you want to be part of our group,
Yes, we would love you to join us.
it's so much fun.
Yes.
We have a great time. We have a happy hour coming up too, by the way.
So what we do is very gratifying because we, on a personal level, like I said, I took care of my grandparents. I actually had to translate for them in the hospital, so I would spend 2 or 3 weeks with them every single day, missing school, just to be with them because they couldn't afford private duty, or we didn't even know there was private duty.
And you learn so much just from that.
Yes. And so having had that, now that we have all these resources to help these seniors, it's very, very awesome.
And I think the biggest stress that most have is now, okay, we want these services. How are we going to pay for them?
Right.
Do we have long-term care? So that brings us to...
So that's where Shari comes in.
Yeah.
So also with us tonight, we have Shari Buffa. She is an insurance agent with Bankers Life and Casualty, and her company can help you pay for those services.
Hi.
Hi, welcome.
Welcome.
Thank you for having me.
So can you please explain to us and our audience what your concierge style business is?
Absolutely. So I work for Bankers Life. I am a licensed insurance agent. I'm also certified in long-term care, so I have an extra designation around long-term care. But Bankers Life is an insurance company that deals with everything around retirement and Medicare and long-term care and life insurance and helping people not run out of money. We do everything around retirement. We kind of look at it holistically to make sure there's not a hole somewhere so that everyone's covered. The concierge part is I work a little differently. We do go out and meet in person, first of all. I don't do stuff over the phone. If someone's sick or they're traveling, I will do stuff over Zoom. But we go in the home, we do a needs assessment, we get to know them, what is going on with them. We certainly do a lot of stuff with people first turning 65 when they're going on Medicare. We do very comprehensive personalized education. Some people need to go on Medicare, some people don't. They're told all the wrong things by their friends. So we like to come in, understand what their specific situation is, see if they're still working, if they want to stay on work coverage, or they're going to go on to Medicare. Do very, in-depth. A lot of people we tell to stay on their work coverage, so we're not always just telling people to do that when people are ready. Something that we do different. Most people that do what I do, they'll say, call me when you get your Medicare card. Well, I come in, I create their government accounts.
Wow, that's a lot. I think that's so overwhelming for most people.
It's not something that I was necessarily taught by Bankers Life, but I saw a need for it. People were mailing in forms, they were getting lost. You cannot
Or they do it online, and if you answer the wrong question, it sends you to a whole, do they own a car? No, I mean, yes, too late, you're on page 7 now.
If you answer it wrong,
you've skipped ahead. We've done it. When I worked for Solkoff Legal, we helped people, and
I like to sit there and do it with them. I create the account for them. It's very confusing to create a socialsecurity.gov account. That's how you apply for Medicare. I help people apply for Social Security too. That is also confusing.
Yes.
People sometimes work and they're transitioning on later. I know how to do that online. I have mastered all of these government sites. I walk people through. I calendar. I make sure that they're following up.
How long have you been doing this?
I've been doing it for 6.5 years.
Oh.
I wish I knew you years ago. You have no idea what I went through. I am not from this industry. Trying to understand Medicare and Medicaid and VA and Social Security and all of that, even to this day, I handle all of that for my parents, and it is so scary. Every time I have to go onto their account,
you start sweating.
And every year they have to do a renewal or anything, and I'm so terrified that God forbid I press the wrong button by accident. I'm gonna mess something up.
Or delay the process.
Oh, delay it, or they get cut on their benefits, and
And do you find that, do people ever come to you because they've screwed it up and now you have to fix it?
So I fix a lot of people. I had someone referred to me recently by a client. He had worked later, so he was 67, could not figure out how to get the Part B to work. He got referred to me. Literally, I have a partner, Sarah, so we went out to go see him. We literally, like within 2 weeks, had his Medicare Part B processed, got his prescription plan done. All I do is go and fix stuff. So I try to get people set up properly. If I can't save everyone until I meet them, but I get them set up properly in the beginning. If someone's screwing it up, I will help them. The other thing is, working over their long-term care. I try to educate them. People think that Medicare covers long-term care. It does not cover long-term care.
Right.
And even though people know that and they've been taught that, when something happens, everyone forgets. They're like,
wait. They still call us at Senior Helpers and say, okay, so I have Medicare and I want 5 hours a day, 7 days a week. And we're like,
doesn't work that way.
You're not going to get it.
No,
I know.
That's how I met you. I came in to teach about what Medicare actually covers and what it doesn't cover. And it's so important. Although I help a lot of people when they're first going on, one of the biggest things that I find, people think that they're all set. People are not always all set.
No.
They're set up wrong. They don't do certain things. So it doesn't matter how old you are. I am able to come in and review and help and just see what's going on, and maybe you're not set up right.
And is that something they should every so many years review it and look at it? Because I even know with your living will, your power of attorney, or whatever it is, every so many years you should go back and check that. That's probably the case with you too, then, right?
The component, it's actually every year, believe it or
every
not.
okay.
Yes. There are parts of Medicare that you need to change every single year, specifically for people on original Medicare, their Part D prescription plan every single year. Some of the plans kicked trazodone off last year. Trazodone's an old, inexpensive medication, and if you're taking it and you didn't change your plan, then now you're getting it. It's going to be really expensive, and you don't know any better. I had a client. I called her. I don't, profit or make any money off these prescription plans, but that's something I do for all my Medicare clients. I go every year and I review their prescription plan. I called one of my clients 10 minutes before. She's like, do we need to meet? She texts me. I'm like, well, yes, we need to meet. Meanwhile, one of her medications was kicked off the formulary. Had we not gone on the phone and changed her prescription plan, she wouldn't have been able to get it or paid a really high price. So every single year.
But that says a lot about you. And I think all of us, because of this industry that we're in, you have to be compassionate. You have to be caring. And so when we come back after this commercial, we're going to talk a little bit more of how you have to deal with the family dynamics and how you have to go in and meet with the family or meet with the kids and say, this is what's happening. And
a lot of times educate them. There's a lot of misconceptions
but you've got to be
Medicare and long-term care.
And kind and loving. I'm sure Jane feels the same way. You get in and you've got siblings making decisions and none of them get along, or mom only likes one, doesn't like the other two, or so it's how do you, this type of industry, you've got to be a loving, kind, compassionate person. And I think if you're not, you can't do this.
Yeah. Join us after the break so we can talk about some of those misconceptions.
See you soon.
In support of all the work that Amy Decker and Shayne Silver do for our senior community, Prepare to Care Emergency Companions is honored to sponsor this segment of Senior Strategies, Tools for the Caregiver.
Hi, I'm Amy Decker with Senior Helpers.
And I'm Shayne Silver, a seniors real estate specialist with the Silver team at Keller Williams.
We are so excited about a new show that we're launching, Senior Strategies, Tools for the Caregiver.
We know that being a caregiver can be lonely and very overwhelming, and we want to help.
And so we hope to empower you with resources and tools that you probably didn't even know existed.
We'll be having some great conversations with people and companies you probably never knew existed and never knew you needed.
We just can't wait for you to join us.
Come join us for some laughs and fun as we give you some tools to use.
See you soon.
Are you considering selling your home? Are you considering downsizing? Are you considering a transition to an independent or assisted living community? Are you considering moving to be closer to your family? Do you need a home more conducive to aging in place? If so, you want to talk to Shayne Silver, co-host of Senior Strategies and Senior Real Estate Specialist. Shayne and her real estate team are extremely knowledgeable and experienced when it comes to helping seniors and their families make life's important transitions. Shayne will guide you every step of the way, making the transition as stress-free as possible. To schedule a no-obligation consultation, call 561-735-3030.
Hi, welcome back to the show. We're just having a great conversation here talking with Shari Buffa and Garcia Deale about what they do.
Yes, and we're back, and I want to ask Shari, who was talking with us before the break about long-term care and Medicare.
Okay.
Some of the biggest misconceptions people have about Medicare.
Okay. The first thing, people think Medicare is for free. That is the biggest misconception. There is a cost to Medicare. It is income-based, and it goes from every year of your life, it goes from the 2 years before. So that is something that I really sit down with people so they can talk to their financial planners, their accountants on how to stay within certain income levels, because sometimes you can sell a property, you get an inheritance, and half your Social Security's gone, and now you can't pay for it. So
now, can't they go to like an elder law attorney and put those things in trust so they're not looked at as an asset, or no?
It depends.
Because sometimes they can do like a family asset protection planning where they take it and put it in a trust, so it's now looked at as not an investment.
When you set yourself up properly, I'm not saying not to do that, but when you get yourself the right kind of Medicare, that's the other thing. There's different kinds of Medicare. There's original Medicare and there's Medicare Advantage. They don't work the same, and I think people think on Medicare Advantage they can go, if they're on a PPO, they can go wherever they want, and that's not the case. So I need to explain people before they make decisions that they can't get out of. You can't always change. To go back to original Medicare and certain types, you have to go through medical underwriting. So I like to explain that so people know their rights and options when they're making these big decisions.
Oh, so you can't switch
that is
to
so
a different
important.
one.
It depends on the situation.
And we had ran into that issue with my mother, and it was very, very difficult. When I finally took over her care, she was on a Medicare Advantage plan, and it was fine until we moved them from Broward County to Palm Beach County, and that was the first issue. And then there was another issue when they moved them into their independent living, and then there was another issue again when we moved them into assisted. Finally, we had to take her off the Advantage plan, but I was so afraid to push that button because I knew we couldn't go back. And I probably called 6 different people to explain it to me.
So where were you, Shari?
And I give you so much credit.
Where were you, Shari?
I give you so much credit
we
because
could have used you.
From
I
now.
don't know how you keep it all straight. There is so much to know between Medicare and Medicaid. There's so many things to know, and they make it so difficult.
They make it really difficult. I am definitely an expert in Medicare. I joke that I'm like the Medicare whisperer, but I'm not an expert on Medicaid. I do have clients on Medicaid, and getting back to putting stuff in the trust. So some people do elect to do that. One thing I want to say, when you have long-term care, right, people can either get long-term care insurance if they can afford it or qualify for it. They can spend down or put stuff into a trust and go on Medicaid, or they can self-insure if someone has enough money. When you're on the Medicaid path, you don't get to choose where you are always. So that's the difference between.
So you get what you get.
Yep.
That can happen. Nothing is guaranteed on that path. When you have the right, the certain type of Medicare or certain type of long-term care, you have all the freedom in the world to go wherever you want. So when when people choose to get long-term care insurance and they can get it, that they have all the choices in there. So it's hard to say.
Please explain what is long-term care.
Okay, so long-term care it's insurance, and it is medically underwritten unless someone gets it through a group health plan, which is very unusual. Very few people do that now, but you have to go through medical underwriting. You basically, pick like a pool of benefits, and what happens when you get to a situation where you have 2 activities of daily living, that you can't perform. If you have long-term care insurance, that would then kick in. People usually have waiting periods, so a lot of the older ones that were written are 90-day waiting periods. So
And that's when you call senior helpers.
right.
And a lot of them do have 90 day. A lot of them have 90 day. And that confuses them because they think, okay, so I'm just going to do 1 day a week for 2 hours a day. And some of those are even different. It's not sometimes the day, but it's the hours that they count.
They're
also different.
They're all different.
Every policy is different. Every situation's different. And it's when you go see all the old policies, they're all different. So a lot of people think they can't afford it, which that's the biggest thing I hear. Well, I can't afford it. It's too expensive. What I will tell people, and I've seen just in my own experience, sometimes it's better even to have a smaller policy than to have no policy at all. I had a family member who was in the hospital, needed to go to rehab. They wanted to know what the insurance was. I explained it was original Medicare and a supplement. They're like, well, do they have long-term care insurance? I'm like, why? That doesn't pay for rehab. Medicare does. They said, we want to know that there's a plan when you go home. So even if you had a small policy in place, that's a plan. Then you're not a burden to everyone. If the market's crashing, you don't have to sell off money. You have a plan for that initial period of time, and you could figure stuff out.
But we find some people, they're 99 years old, and they're like, ooh, I don't want to start using it because then when I really need it, it's not going to be there. So I'm going to wait. I won't start the claim until I really need it because I really don't need it right now. Where they've paid on this for 50 years and they've got a great plan. They're afraid to touch that.
They would tell me that too, and I'd see them in the hospital and they're like, we're waiting for a rainy day. I'm like, it is pouring.
You're
in the hospital.
I have clients.
There's a hurricane.
I don't understand. They're like, I'm waiting. I'm like, what are you waiting for?
Right.
I don't always understand. I do think you have to be smart. You have to understand what your benefit is and how many hours you're going to use it. You know, some people still have unlimited benefits, so then there's still a cap on that. But I think my clients, or I work with old policyholders of Bankers Life, I go out and meet with them. I let them know what they have, so they can plan when they're going to use it and be strategic. That's the point.
I think that's so important too. I think a lot of people out there probably bought it a long time ago and don't know what they have. Right. So I'm going to challenge all the caregivers out there to do two things. Number one, go check and find out what you have.
What type of wait period.
What the waiting period is, all the particulars. And for those of you who don't have anything, start planning now because you want to plan before there's an emergency.
Right. And here's another mistake I think we find is we will get care in place. It'll be a very sad story. They're older. You know, they'll get care in place, and now we get concierge in to do PTOT, and now the person's getting better, but they still want to be able to glean off this. So when the long-term care company calls, they say, oh, I'm doing so much better. I can reach the cabinets. I'm vacuuming every afternoon. I'm cooking. I shoveled the driveway, and they're like, oh, great, you're done.
They don't want to be a victim. They don't want to say, I can't do something. And
so we always tell them never.
Then they get rejected.
We're happy that they're doing better.
But one thing I want to say is sometimes when someone has, something and they can't get long-term care, or maybe the spouse should still get it if they're healthy enough and able to get it, because it's too much burden if neither one of you have it sometimes. At least if the person that's still healthy can qualify for it. We also have plans that they're a little bit smaller, but they're still a nice benefit. They only look back 3 years. So there's people with diabetes, they couldn't get long-term care insurance before. And now this policy, as long as they're not on insulin, they can still get it. Or there's people that have had cancer, but they're more than 3 years past it, and they're able to qualify. I literally have plans that I can place with people in their 60s and 70s that have had a health issue that they're a little bit, that they're a certain amount of years past, and they can still get something right now. And they're so happy to have the peace of mind to have that there.
And Jane, you had a couple of questions too, because you work kind of tandem with her, trying to make sure that you're...
So two things. We did have a patient client over in one of our assisted livings, and this broke my heart because apparently long-term care isn't forever. Plans are different, and they ran out of their benefit. And here they live in this very high-end community, and now you're shuffling around to figure out what's going to happen, and you have to move out. So what happens to that? What can you do to help them?
You know, it's hard when you get to the point already where everything has been exhausted. What I encourage also when people do is long-term care is a piece of the puzzle. It is not Medicare is a piece of the puzzle. Your financial is very important. I find when I meet people when they're retiring, they're working with, they either don't have a financial person or they are working with people that were worried about accumulating and making the money and growing. But when you get older, you have to shift. You want to make sure that your money stays there or that it can produce income or for care later on down the road. I work with a lot, I don't do that. I work with a lot of advisors that is their specialty, to help people plan for care down the road to avoid those situations. If you get to the point where you're already upside down and you've pulled out too much money of what you were able to, it's very, very hard into those situations, and then they are going to end up possibly in a Medicaid situation and not having their own choices.
So there may not even be a solution to that problem.
There are people, because I do a lot of people that are turning 65 or retiring. Those people are retiring with 401ks or with a certain amount of money. There are things people can do to avoid those situations down the road. So you want to do that right when you're first retiring. You know, people think, I don't want to talk about long-term care, I don't need it. Well, once you need it, that's not the time
it's
to
too
talk
late.
About it.
Right.
And then it's too expensive, isn't it? I mean, if you wait till you're...
The older you are, the more expensive it is. But there are still options for people in their mid to late 60s and all the way up until, through their 70s. People can still get it if their health is there, as far as they look back. But like, you don't know unless you ask. And you were talking about people not knowing their benefits. Sarah and I once did, and I thought it was great. We should probably do it again. We went to a community. Someone asked us to do this. They wanted people to bring their long-term care policies to us so we could explain to them what they had. Sometimes people, they have inflation riders on it, and they're at an age they don't need that anymore, and it brings the price down for them, and it makes their life a little bit easier. We do a lot of financial reviews for people. They're double paying for things, and maybe they can put more money towards care or other things if they had someone really going through all that. And figuring out, what it is they need and how they can cut certain things and add to the parts that are more important. Sometimes even people will, life insurance, they'll take, rearrange the life insurance to have more money towards long-term care and care because your needs change. Your kids are grown, so you can shift some of those things around, and that's something else we can look at.
I think it's so important too, is that people read articles, they go on the internet, they think they know what they do, they know what to do, but a lot of the resources you see online are very general. It's so important that you meet with a professional to go over exactly what your goals, I mean, what I need is going to be completely different than what you need.
So true. The worst thing you can do is just go online and think you can look this stuff up or call someone on the phone. When you do that, they just want to sell you something. I've seen people get sold HMOs for their Medicare that live in 2 states. They only work in the county. So when you are on the phone with someone, all they care about is a commission. Right. I think it's so important is to face by face with everyone's prescriptions, their basket full of prescriptions, all their different things. I went to go visit one of my clients to review the prescription plan during annual election period, and she said she was prescribed Prolia for osteoporosis, and they told her it was $2,000. I said, what do you mean? That's a Part B medication. It would go through your doctor's office and Medicare, and your supplement would pay for it. Made some phone calls and fixed that for her. She didn't know. So if you don't ask questions or you don't have a go-to person, part of what we were talking about, me Concierge, I have people texting me, calling me 7 days a week. That's my service. I don't charge to work with me. But why wouldn't you rather work with me for no money, to do everything for you, to call Medicare for you when you're having a problem, to look at a bill, tell you if you owe it. I mean, I cannot tell you the amount of things I do to help my clients, and I don't charge anything. So I don't know why anyone would call an 800 number or go online when you can. And
so that is the blessing of having the both of you really on our show as guests. So we have people that are listening in from all different states. I think the majority of our clients that call in, their kids live in New York or New Jersey or Connecticut or whatever, so they're listening in or they're viewing this right now. How can they again get a hold of you? They say, great, we'll talk to her, let's get this together. How do they get a hold of you?
So my cell phone number is 561-212-4111. I am actually licensed in New Jersey. I'm licensed in Virginia. I'm licensed in Florida. I'm also willing to get licensed in other states. I get on the phone with people. I get on Zooms with people, with people's kids. I invite the kids to be very involved and be part of meetings when it's necessary, to be able to do that. And, You know, I never look at things. Some people, I went to go meet with them and I told them not to go on Medicare, or they can't afford long-term care, or whatever it is. They're like, I'm sorry I wasted your time. But I don't look at it like that. How would they know unless they met with me? And I feel like, you know, this business pays it forward. Then I get referred to somebody else because that I can help. But I think, you know, it just starts with just meeting and figuring out what you have going on, your own exact situation.
And all of this is really pay it forward. I think that's the whole theme of our show is finding tools like the both of you have and strategies of how all of us together can make a better situation for somebody in the home.
Every caregiver needs a toolbox, right? And these are two amazing tools that you could use to help yourself, your loved ones. Thank you both so much for being here tonight.
We have so many more shows that we're going to be talking about, but be sure to watch even at the end of the show because we have
some amazing sponsors.
Amazing sponsors that are helping us kind of get off the ground here a little bit and get our show up and running. And so there's going to be a whole little placard at the end that you can make sure you see everybody on there.
And if you have any questions for us or any of our guests, or if you have any topics you'd like to discuss in the future, you can reach us directly at 561-800-6654. Please reach out. Don't be afraid. And hopefully we'll see you Thursday night at our support group.
Yeah, or you can email us at seniorstrategies.pb@gmail.com. We look forward to hearing from you.
I would look forward to seeing you next time.
Thank you for joining us today on Senior Strategies. We hope that you found the tools and the strategies that we offered you beneficial for your journey as a caregiver. We want you to leave today feeling empowered and supported.
Please follow us on Instagram, Facebook, and YouTube for upcoming shows and events. For more information, to schedule a consultation, or to join a support group, please contact us at 561-800-6654.
And remember the strategies
and tools you can use
to make your journey easier.
In support of all the work that Amy Decker and Shayne Silver do for our senior community, Prepare to Care Emergency Companions is honored to sponsor this segment of Senior Strategies Tools for the Caregiver.
Hi, I'm Amy Decker with Senior Helpers.
And I'm Shayne Silver, a seniors real estate specialist with the Silver team at Keller Williams.
We are so excited about a new show that we're launching, Senior Strategies Tools for the Caregiver.
We know that being a caregiver can be lonely and very overwhelming, and we want to help.
And so we hope to empower you with resources and tools that you probably didn't even know existed.
We'll be having some great conversations with people and companies you probably never knew existed and never knew you needed.
We just can't wait for you to join us.
Come join us for some laughs and fun as we give you some tools to use.
See you soon.
Are you considering selling your home? Are you considering downsizing? Are you considering a transition to an independent or assisted living community? Are you considering moving to be closer to your family? Do you need a home more conducive to aging in place? If so, you want to talk to Shayne Silver, co-host of Senior Strategies and Senior Real Estate Specialist. Shayne and her real estate team are extremely knowledgeable and experienced when it comes to helping seniors and their families make life's important transitions. Shayne will guide you every step of the way, making the transition as stress-free as possible. To schedule a no-obligation consultation, call 561-735-3030.
Welcome back to Senior Strategies with Amy and Shayne. Coming up next are more tools and resources you will need to make your journey of caregiving a little easier. For more information or to be a guest on the show, please contact us at 561-800-6654. And now, on with the show.
Hi, welcome back.
Just kidding, we're back.
JK, we're still trying to learn the hand signals of what means cut, 5 minutes, commercial, 10 minutes.
We're still working it through, but I'm glad we're back because
we have a lot more to talk about.
Jane had something else she wanted to mention.
Yeah.
I just wanted to share something that's really important on a personal, on all kinds of levels. We are crisis planners by nature. I think that's a big problem that we have, and hence why, you know, we don't know about long-term care. We don't know when we need private duty. We don't know who pays for what. For our seniors out there, our caregivers, our case managers, our care managers, you need to go out there as a patient, as a client, go tour some skilled nursing facilities, nursing homes, whatever they call them. Go tour some of the short-term rehabs. Tour some of your hospitals.
And tour it before it's an emergency.
Yes, exactly.
And you're doing it out of just sheer emotion.
Medicare says it is your choice. It's your choice what home health agency you use. It is your choice what physical therapy Part B you use. It is your choice what physician you use. You can change them on a daily basis
but
if
the
you'd
nice
like.
thing is, if they haven't done it, you know so many of them. I know so many of them too. So we're also a good resource if they are in a tragic situation. They have to make a decision.
Right.
Very often we'll say, well, show us what is going to be covered,
right,
and we'll give you the good ones to go to.
And
so
even the ambulance, even, I mean, I don't think it's changed much, but they will take you to your facility of preference unless you have something critical going on.
Right.
They have to take you to the closest facility, but otherwise, or hospital, but you can go, you can choose and be in the right, you know, the right place where it's going to be best for you. So
absolutely,
that's a good point. Do that research.
Stay
beforehand.
educated, be proactive on all of it. And I know even when I worked for Solkoff Legal, that was elder law, so often they'd walk in the door and it was tragic. It was a tragic situation. Now mom can't make decisions because she doesn't have the capacity. Now they got to look into a guardianship.
They don't have a power of attorney in place.
They haven't looked at their will in 10, 15 years, and half the people on it are dead. That they're
and I will
leaving
tell you
things
this
to.
right now. If you're the caregiver, that's a tough conversation to have with your parent or your spouse. Hey, let's
look at the will.
Let's get this stuff done now. But if you are the person being cared for, it is the greatest gift you could give your child or your spouse is to have everything
organized,
done and organized and ready.
And decisions made.
As an adult child caregiver, I am very thankful that that is one thing my parents did do.
Yep.
They did their pre-planning. This is actually a really funny story. They did their pre-planning for their funeral, which I'm really glad they did. But when it came time to move them into an assisted living facility, the assisted living facility required that they have it. And they said, oh, we already have it done. They live down here, but we're being buried up in New York. But everything's taken care of. I said, that's great. Can I have a copy of the paperwork? So God forbid something happens, I know where it is. And my dad kept saying, it's done, it's done. And I said, Dad, it's not like I can call Delta and say, here's the body.
Or
I
call
need
the
some
attorney
paperwork.
that put it together.
Or
and
call
said,
the attorney.
yo,
right. I said, I need the paperwork now. And it's not as easy as, hey, Delta, I have a body for you. Unfortunately, I know that sounds horrible, but it's so important to get that done before so that you're not planning for a tragedy.
Exactly. And anything that any other little closing points either of you would like to share just regarding this?
I think, you know, one of the things, you know, especially with what Jane does, you know, with coming in with those Medicare services, I think when people are first going on Medicare or they're choosing HMO or even over PPO, they don't think about they're going to need someone to come into the home, and they may not take what they chose when they were young and healthy.
Right.
So that is why the education is so important. That is one of the biggest frustrations is the rehab and some of the companies that come in with the Medicare services when you can't leave your home, that you need to have the right kind of Medicare or specific situations like that.
But how rewarding for you, probably when somebody does come to you with a complete disaster of a plan, or they did click to the wrong button, which sent and screwed up their Medicare or Medicaid, that you can make a difference in their life. How rewarding to you, Jane, when someone just gets home from rehab and they're atrophied and they're sick and they don't want to live, and then sometimes we even hear them say, I just want to die, I don't want to live like this. But you can get them happy again and up and moving. And
the biggest part for home health is that we're actually the eyes and ears for the physician in the home.
Yeah.
We get to go see that they have a drawer full of medication from 5-10 years ago that nobody's ever cleaned out. So our nurses go in there, they check the refrigerator to make sure there's food. So we really take care of that patient as a whole. And not just because the doctor sent us in for physical therapy, we're going to do the leg therapy. We have podiatrists that do house calls.
Right.
We'll have any doctor that they need, we can bring into the home. There's a lot that we can do to help them.
Yeah, one of the things that Senior Helpers does is a home health assessment where the nurse will go in initially and look for slippy rugs. We'll look for making sure the medications are in the right place and those types of things so that we can present it to the family to say this is what they need. And then we follow up with wonderful sponsors and friends and colleagues and guests for our show, like both of you. And we look so forward to just planning out the next few months of who we're going to have on the show. We've got some really good ones coming up. And again, we've got great sponsors that are helping us out right now. And if there's something that you'd like to talk about on our show,
a topic
or
you want to
feel
hear,
this venue is a good topic for you, we'd love for you to get in touch with us.
we'd love for you to be a guest on our show.
That's right.
So we look forward to seeing you next time.
And be sure to look at the sponsors at the end. Thank you.
And remember, you're not alone.
There they are. There's all our sponsors. Jane, you're on there. Michael Mole with Senior Helpers. Keller Williams. Yay!
The Silver Team at Keller Williams.
Yay! Thank you so much. We appreciate all of your loyalty,
Support and generosity.
generous sponsorships. Yep.
And we hope to see you next time right here on Senior Strategies, Tools for the Caregiver.
Bye-bye. Thank you for joining us today on Senior Strategies. We hope that you found the tools and the strategies that we offered you beneficial for your journey as a caregiver. We want you to leave today feeling empowered and supported.
Please follow us on Instagram, Facebook, and YouTube for upcoming shows and events. For more information, to schedule a consultation, or to join a support group, please contact us at 561-800-6654.
And remember the strategies
And tools you can use
to make your journey easier.